West Side. So today I decided to dress up as Tupac, and one of my really long-time friends from the 7th grade, we dressed up as Biggie.
So,
And yeah, it was a lot of fun. Tupac's one of my favorite artists, and on the previous post you saw one of his lyrics that is still really poignant today about just the treatment, the harsh treatment that men have against women. So just wanted to bring his attitude, his vibe into chemo today. Kind of have that thug life attitude, because today was really important. What today was my results of my first CT scan. And so this was the first CT scan after doing 2 months of chemo and immunotherapy. So going into this, I was really nervous, just not knowing what the results might be. Like, well, what if the results were bad? What if they show that during the treatment that nothing happened, or that the tumor had been growing? So there was a lot of anxiety around, what that might be. So Wee was with me, and also Jackie was with me, and went into the appointment with Dr. Tempero, who's the head doctor for the clinical trial. And good news. So what they told us was that I have a 10 to 20% shrinkage in the pancreas. So the tumor has shrunk 10 to 20%, and then the liver is stable. And so that's really positive. So at this early stage, that it's moving in the right direction. And so what that also means is that we get the green light to continue on this clinical trial, and just hoping that this will just continue to happen. And then I guess what's happening to me on the physical level is that it seems that my body is starting to stabilize more. So they say the first 2 to 3 months are the hardest, and that first week of treatment was probably the most tough, when I had the most side effects. Right now the side effects are getting a little bit more managed, except for this last stint last week where I had these blood clots and literally could not walk because of the pain. So fortunately that has dissipated and I'm able to walk, but I'm still having to take these Levonex shots twice a day into my belly to prevent from further clots from going. So right now I'm in my first week of round 3, and this is going to be a tough week because I'm going to have 2 treatments. So today I have chemo, and then in a couple more days I'm going to have immunotherapy, which has their own side effects. And then that's on Wednesday, and then the following Monday I'll be back here again doing chemo. So I'm just trying to get my mind in that zone to just be able to withstand the next week and a half, where I'll probably be pretty much out of it. A lot of fatigue, sleeping, and hopefully besides that, hopefully I'm not going to have other side effects. But I'm just going to really stay positive today, and really, feel good that the CT scan was really positive, that it's shrinking, and that's all I can hope for. So thanks again for following and supporting me.